This morning, we're going to focus on staying healthy and happy in this new fall season. And here to help us, NBC News medical contributors, Dr. Natalie Azar and Dr. Torres. This is going to be a podcast soon. We're workshopping it here first, though. First question. This is Lindsay from Roswell, Georgia. Let's listen.
Is it too late to get a flu shot? And do I still need a COVID shot, too?
Good question.
Okay, thank you, Lindsay. So we'll start with COVID first. COVID shot is recommended for everybody 6 months and up. So you're wondering if you should be getting it. Well, we certainly want our immunocompromised patients to be getting it. We know we had a big summer surge that's now finally coming down, but we anticipate in about 6 to 8 weeks that winter surge is going to bump up again. And there's a new variant that's coming from Europe. It's called XEC. It's probably going to kind of make landfall, if you like that analogy, like right around the winter season. For flu, also 6 months and up. We also want to recommend that you get it by the end of October. That's really what's recommended for that. For kids, if you are 6 months to 8 years, we recommend getting 2 shots if you've never had the flu shot before, 4 weeks apart. And I always want to give a shout out too for our folks who are 65 and older. There are 3 different preparations that are available that are a bit of a higher dose to boost the immune response. Something new for next year, Chanel will never have to get a shot again.
What is it?
Flu Mist nasal spray has now been approved to use at home with a doctor's prescription, that if you're 18 and older, you can self-administer or you can give it to someone who is younger between the ages of 2.
My kids don't need a shot?
Potentially.
Oh, that is it.
Between 2 and 49.
That's a game changer.
Little caveat. It's not recommended for absolutely everyone. It is what we call a live attenuated vaccine, which means if you're immunocompromised, pregnant, or have some other medical issues, you might not be a candidate.
That's okay.
But Chanel, you'll be first in line, girl.
So there we go.
So besides flu and COVID, what other sicknesses will we be see going around?
So the 2 big ones, RSV and whooping cough, or pertussis as we call it. And it's important to look at these as well, especially as we get into the winter months, because their peak season tends to be January, December timeframe, and they can be devastating. For RSV, the vaccine is recommended right now 75 and above, 60 to 74 if you have conditions that can make it more dangerous for you to get RSV. And so it's extremely important that that group looks at it. I also tell them, if you're a grandparent and you have young grandkids, talk to your doctor as well, because that's something that might be needed. Pregnant women, especially between that time period there, need to look at getting it as well, because that protects their baby, and not only them, but also when they're born. This is not an annual vaccine. This is a vaccine that you get at one point here, and going forward in the future, we're not sure of how often you have to get it, but right now it's annual. As far as whooping cough, pertussis, if you get the tetanus shot, that's DTaP or Tdap, depending on your age. That P is pertussis. You get that in there, and so that should be something that most of us have on a regular basis. But whooping cough is very common. It's very contagious, just like these other ones. And the cough can go on for weeks. It can go on for months. Being in the emergency room, treating patients with whooping cough, babies, you do not want to see your child have pertussis, because it is one of the most sad things you can look at, watching a child try to get breaths with this. And that's that whoop noise they make that can be very dangerous for them. Now, it is important that if they do get this, that treatment starts before the cough starts, because it's important to catch it as early as possible. And there are vaccines for all ages, like we talked about. And so it's important to get those as well.
Good segment. All right, let's go to another viewer. This is Raul from Albany, New York.
How do I know if my stuffy nose is a virus or just fall allergies acting up?
That's a great question.
Hi, Raul. Thank you so much for this question. So I think I wanted to create a Venn. Oh my gosh, you did it, Robert. What? This is brilliant. Okay, so virus versus allergy. In the middle, you can see the symptoms that are shared by both viral infections and allergies. Runny nose, congestion, cough, sore throat. How do you distinguish? A virus is a bug. It's going to cause a fever typically, muscle aches, often GI symptoms. A virus is going to come on suddenly, and it usually lasts about 7 to 10 days.
And there's nothing you can do about it,
and there's no treatment for most viruses, correct, except like flu. Yes, there are some antivirals. And for allergy, itchy, 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 eyes, nose, and throat. It can worsen asthma, and it's not going to go away after 7 to 10 days. It usually lingers for weeks. Remember this if you remember nothing
This is
else.
good. You know, you can just save this and use this.
Yes.
We'll talk about it again.
Dr. Natalie's so excited about her Venn diagram.
I love my Venn diagram.
I love it. Dr. John, thank you both.
Thank
Look
you,
forward to the
guys.
podcast.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.